Hey everyone, my name is Dr. McBride and I'm a dentist here at Krum Dental Associates. As the school year begins, so do all of our favorite high contact sports such as football, basketball, volleyball, and if you're my son, even competitive chess can be a threat. And with these sports comes the chance that your child or a child you know may have a tooth knocked out. According to the American Association of Endodontics, more than 5 million teeth are knocked out every year in children and adults. And it's with that in mind that I want to talk about the steps you need to take in order to properly save a knocked out tooth. Now, if you find yourself in that situation, the first thing to remember is not to panic. Having a tooth knocked out doesn't necessarily mean that the tooth is lost for good. There are some very important steps to follow to give the tooth the best chance of survival. And after watching this video, you'll be armed with all the information you need to save the tooth. The most important thing to remember when a tooth is damaged is to act quickly. If a tooth is chipped, gather the broken pieces and take them to the dentist for repair. Sometimes we can actually bond the broken piece of tooth back to the tooth in your mouth. If the entire tooth has been knocked out, check to see whether it was a permanent tooth or a baby tooth. Baby teeth cannot be reimplanted. But it's still important that you see a dentist as soon as possible to check that any broken pieces of the root aren't remaining in the gum and that the underlying permanent tooth hasn't been damaged. Now, if the tooth is a permanent tooth, time is of the essence. You're going to need to find the tooth immediately. And once it's located, pick the tooth up by the crown or the top of the tooth. You don't want to touch the root of the tooth because the root contains important fibers that are necessary for proper healing. If the tooth is dirty, rinse it with water gently. Don't use soap or scrub the tooth. Don't dry the tooth or wrap it in any sort of tissue. You're going to want to reposition the tooth in the socket immediately by gently pushing the tooth into the socket with your fingers. It's important to remember the tooth must stay moist at all times. This can be done in a number of ways. By placing the tooth in the socket, by putting the tooth in a cup of milk. You can also store it in your mouth next to your cheek. They do make emergency tooth preservation kits, but let's be honest, who has one of those besides me? So the main point is don't put the tooth in regular tap water. The root surface cells can't tolerate that for an extended period of time, and it can inhibit healing of the tooth. Again, time is crucial. There's a very good chance the tooth will survive as long as it's replaced in the socket within the first 5 minutes of the injury. Between 5 minutes and an hour, there's still a chance of survival as long as the tooth has been stored properly. More than an hour, the chances of survival become less and less likely. Remember, it's imperative you see the dentist within 30 minutes of the injury. Be sure to bring the tooth with you to the emergency visit. At this appointment, the tooth will likely be reimplanted and splinted to the adjacent teeth from anywhere from 2 to 8 weeks. Nerves and blood vessels are damaged when a tooth is knocked out, and it's likely your tooth will need a root canal. But the bone and tissue can reattach to the root of the tooth if it's put back in place. Now that you know what to do if a tooth gets knocked out, you can worry about more important things, like prevention. A properly made mouthguard can protect teeth by cushioning the impact and dispersing the forces. If you need a custom mouthguard or have a dental emergency, Krum Dental Associates is here to help. Just give us a call or visit our website at www.krumdental.com.